There is a class of children that can not only be relieved of their suffering, but a great majority of them cured, who, if not cured, are doomed to live through years of suffering, and later become wards of the state. They must eventually become beggars or dependents.
In 1897, Dr. Arthur Gillette's leadership to found what is now Gillette Children's Specialty Health Care in St. Paul, Minnesota, at a time when there was very little access to specialty care, marked a radical change in the care of children with disabilities, and challenged the common perception that they should be pitied. His legacy is still seen today as Gillette Specialty Health Care continues to provide groundbreaking medical care, impacting the lives of children and adults with disabilities across America. At the turn of the 20th century, it was estimated that there were no fewer than 6,000 children in Minnesota with physical disabilities. The majority of these children were still untreated. They were given the label of crippled or deformed. Families had little access to proper medical care, and many parents were not even aware of the treatment options available to them. This need was first brought to the attention of the Minnesota State Legislature by a young woman named Jessie Haskins, who felt great empathy for children with special needs because she herself had severe scoliosis. Jessie Haskins was able to present an impassioned plea, but she knew she would need more than that. The idea of a state-funded hospital dedicated solely to the care of children with disabilities was completely unprecedented, which meant that there wasn't an institution in the country or even in the world that could be used as a model. In order to gain momentum in the legislature, as well as to come up with a plan that best fit the need, she needed the help of someone with expertise. This brought her to the office of Dr. Arthur J. Gillette, the first practicing orthopedist in the state of Minnesota.
Dr. Gillette came from a very average background. He was from a farm family and did not want to farm. It took his mother's help to convince his father that being a physician was a good idea. Being a physician at that time wasn't necessarily considered an advanced position or necessarily a skilled position. In some ways, they were viewed as something to be a little skeptical about. Who knew what they were going to do? But he had gone off and done extra training to study what today we would call orthopedics. And he had come home and started working in St. Paul, and he had developed a reputation for taking care of children.
Just before the meeting of the state legislature, a young lady came into my office. She wanted to know if I would be interested in a state institution for crippled and deformed children.
The unprecedented nature of this reform brought with it many challenges, but it also provided an incredible opportunity. Because there was nothing to model the hospital after, they were able to present a solution that was perfectly tailored to the need. Their solution? A home. Not just a hospital that could only treat children for a short period of time, where patients saw nothing but white walls and doctors and nurses dressed in white all the time, but a home where they could learn and grow and play as they received long-term care. While there was really no opposition to the idea of establishing a hospital for disabled children, persuading the legislature to appropriate the necessary funds presented two key challenges. The first was the skepticism over the idea of orthopedics, a new field of medicine that had only made its way to the United States 20 years earlier. Treatments focused on therapies and bracing and were seen as bizarre and ineffective. The second was the fact that Minnesota, along with the rest of the country, was going through an economic recession. It was difficult to convince people that a state hospital for children with disabilities, many of whom would never be completely cured, was the best use of funds. Because of this, the bill to establish the hospital was not expected to make it past the Appropriations Committee. Dr. Gillette's testimony was able to convince the committee that the hospital could be run at a much lower cost than originally anticipated. After months of effort, on April 23, 1897, the state legislature voted to establish the Minnesota Hospital for Crippled and Deformed Children. It had been decided that Dr. Gillette himself was the best possible choice to serve the position of surgeon-in-chief at the hospital. Due to the lack of funds, he was given a wing of the city and county hospital to be used for the children's hospital. The hospital was given $10,000 for the first 2 years. Following Dr. Gillette's lead, none of the doctors received an annual salary, but each one donated their time while continuing their private practices on the side. On October 27, 1897, the hospital opened its doors to its first patient, a little boy named Royal Gray. The founding of the Children's Hospital created a new way of life for children with disabilities. In the reform-focused progressive era, society had turned its attention to the social ills of the times. Unfortunately, the common reaction to children with disabilities was to pity them. Dr. Gillette and the staff at the hospital challenged this mentality. Here, the children weren't looked upon as little sufferers who deserved to be pitied. No one wants to be pitied, and these children were no exception. They were able to play, learn, and make friends with other children who wouldn't see them as different, but as playmates. The hospital was so much more than the whitewashed institution that many people pictured when they heard the word. The improving economic situation, as well as the success of the hospital, led the legislature to appropriate funds for a new facility. Built on 23 acres of lakefront property, this new facility was a beautiful home with room to explore. The hospital invested in a school as well as a library where children spent many hours exploring new lands through the pages of books. This was done very economically, spending roughly half per capita what other similar institutions spent. The Children's Hospital had introduced a new model of care by creating a state-funded, treatment-focused, home-like hospital for children with disabilities. Its success drew the attention of legislators, activists, and medical professionals from across the country. People would leave inspired, and before long, other states began adopting similar models. Every day had time set aside for treatment and therapies, school, and for the older children, vocational training. Dr. Gillette and the others at the hospital didn't just want to improve life for the children while they were at the hospital, but they wanted to empower them to make the most of themselves for their entire lives, to recognize their abilities, and teach them to support themselves if possible. Even in its early days, the hospital broke new ground in its efforts to offer the best possible treatment to disabled children in Minnesota through the advancements of the newfound field of orthopedics. Bringing these children together in one place allowed doctors to better understand rare cases and develop the best possible treatment. In 1915, the hospital performed the first spinal surgery to be done in the state of Minnesota. This had to be done as quickly and efficiently as possible, working without blood transfusions or antibiotics and with only ether as an anesthetic. The surgery was a success. Every day, Dr. Gillette, along with the rest of the staff, worked tirelessly to provide the best possible care to the children in the hospital. Gillette continued to shape a vision for a hospital that could also be a home and school to these children for as long as they needed treatment, and send them home as healthy and independent as possible. He insisted to visitors that they must not pity the children and weep for them, because the children did not see themselves as sufferers, and he did not wish for anyone else to see them as such either. Despite his failing health, Gillette stayed on as chief of staff at the hospital until his death in 1921 at the age of 57. During his life, he was responsible for the care and treatment of over 4,000 children. He had been dearly loved by his patients and respected by his colleagues. Prominent doctors, including Dr. William Mayo, co-founder of the Mayo Clinic, attended the funeral to honor the legacy of the man who had contributed so much to the care of children with disabilities. Over 100 years later, the hospital remains dedicated to Gillette's vision of providing advanced specialty care to people with disabilities. Today, the main facility for Gillette Children's Specialty Healthcare is connected to the Regions Hospital campus in St. Paul. Thanks to modern conveniences, care has become more home-based, with very few patients staying more than a few weeks at a time. Gillette Specialty Care has expanded to offer care for older teens and adults at their Gillette Lifetime Hospital. Gillette Mobile Outreach offers specialty care to families in the greater Minnesota area. In 2007, Gillette Specialty Care launched the Cure Pity campaign, a campaign to move attitudes forward through a pledge to see beyond the limitations of children with disabilities, to stop pitying them and see them for who they are.
There are one or two things I wish to speak about in here. The first is that these children do not suffer. Do not look upon them as little sufferers.